Hi, my name is Marcus. I'm now going to deliver a 30-minute exercise program for an older client with a managed condition. The client today has previously had surgery on his knee. He has just completed 12 months of physiotherapy, and our program is designed to assist in getting our client back to running again. The client has already filled out an exercise pre-screening tool. We've also filled out a client profile form for him. He has a referral letter from his physiotherapist, and we have the exercise program for you.
Okay, Harold, what we're going to start with in our session today is the warm-up. What we'll be doing is the warm-up on the stationary bike today because it will give you the less impact on your knees.
Okay.
Because of an injury to the knee, we'll be looking at doing the warm-up for about 10 to 15 minutes. So I'll just get you to start cycling now. Yep, a little bit faster. Yep. And as you're cycling, I want you to remember to push through your heels, brace your abdomen, relax your shoulders, and squeeze through your scapula when you do that. Yep. That's it. That's good. So you should be nice and comfortable now?
Yep.
Yep?
Yep.
That's good. Are you experiencing any pain in your knees?
No.
No, your knees? No? What about in your lower back or shoulders? Are you feeling any pain at all?
No.
No? That's excellent. That's what we want. So I want you to cycle a little bit faster now. And I'm just going to add a little bit more resistance. Can you feel that resistance that I've added?
Yes, yeah, I can.
Yeah. So with the warm-up, what we're tending to do is to take your resting heart rate and increasing it up to the exercise heart rate that will require when we move on to the exercise phase of the program. So, and then that'll help to avoid injuries or anything like that. So if you start fresh at a resting heart rate and try and do some exercises, you may cause some other injuries or whatever. So I want to bring that intensity up to that exercise heart rate that we require for the exercise phase.
Okay.
Cool. So I'll just keep you here for another 10 minutes and I'll just slowly be increasing your intensity. Excellent, good technique. Okay, Harold, now we're going to look at doing the actual exercise part of the program. So the first exercise we've got today is called the wall push-up. And so you can use this, just find any wall at home or at the gym. And you just want to put your hands out shoulder width apart and about chest height. And then you just want to step back, up on your toes, and just lean forward and push down. Push back up. You want your elbows to go out to the side. So let's get you to jump up there. And so hands shoulder width apart, chest height. Step back up on your toes. And if you feel that a little bit uncomfortable, you can step back a little bit further. Step back a little bit further. You want to brace your abdomen. You want to squeeze through your scapula when you come down. You want your elbows to come out to the side. You want to relax through your shoulders. So, yep, slide them down. That's it. This is working your chest area, so your pec majors, your pec minors, so working through your upper body. And what for this program, we're looking at doing 15 reps, and we're doing 2 sets with 60 seconds rest. Just give me 2 more. That's it. Excellent. Harold, the next exercise we're going to look at is the resistance row. So what we've got is we've just got a elastic strap that we can get from any sports store. They do come in different colours with different resistance, but certainly if you find that you've not got one and it's easy flexible, you can just double it over, and then that'll increase that resistance for you. So we're just going to use that, and you can use that at home around any table or chairs. It's just sturdy or stability. You can wrap it around it and use that at the same time. Exercise bike, anything like that. So we're just using the weight tree here. And what you want to do is you just want to sit down and put your legs out in front, slightly bent, and you just want to hold the band in your hands like this, and have a slight lean back, and then just bring your elbows inwards.
Yep.
And just stretch that out all the way back. You want to brace through your abdomen. You want to have relaxed shoulders. And keep your elbows tucked in. Let's get you down and have a go. Yep, legs nice there. You want your shoulders relaxed and down. You want to have your elbows tucked in and just bring your arms to your chest. Yep, nice, and just relax and then back out. You want to brace your abdomen. You want to keep that neutral spine. And you want to be squeezing through your scapula when you're doing that. Basically, you're engaging and working your rhomboids and your trapezes when you're doing that. You want to try and keep your shoulders relaxed as possible as well. That's excellent. Just give me 2 more. And 1 more. And we're looking at doing 15 reps again and 2 sets with 60 seconds rest in between. Cool. Finish up there. Okay, now we're moving on is the partial squat. So what you want to do here is have your feet shoulder width apart.
Yep.
You can put your hands out in front or on your hips, whichever you feel comfortable. And you just want to imagine like you're sitting down on a chair. So you want to brace your abdomen, keep that neutral spine, have your shoulders nice and relaxed, and you just want to squat down as though you're sitting on a chair. So you want to only go as comfortable as you feel. You don't want to go too far because you might cause that injury. So if you just work down until it feels comfortable, have your chest nice and out as well. So I'll get you to have a go. Come over here. Just come over this side. Yep. Shoulder width apart. Brace the abdomen. Neutral spine. Have your shoulders nice and relaxed. You want to make sure your knees don't track your toes. Yep. Excellent. And just come down as far as it feels. Can't feel any pain in your knees or lower back?
No, no pain.
Oh, that's excellent. And you want to do that nice and controlled and maintaining that technique. So that means not going down as far, but maintaining that technique, and that's what we're looking to do. So with this, we're looking at doing 15 reps and 2 sets with 60 seconds in between. Just give me 3 more. Just give me 1 more. Excellent. Okay, next we're moving on is the single leg raise. For this, again, you can use a barbell for stability, or an exercise bike, or a table, but we're using the weight tree for now. What we want to do is just put our legs together, and we just want to have one leg up, and we're just going to, with the other leg, just raise up onto our toes, back down, up, and down, up onto our toes, and back down. Then change over, same with the other one, just up on our toes, back down. So again, have a go. Using the tree. You can have this leg bent a little bit so it's out of the way. Yep. How does that feel?
Yeah, feels good.
No pain in your knee?
Nope.
Excellent. You just want to brace through your abdomen. Have a neutral spine. Excellent. And just swap over the other leg. So with these exercises, we want to try and improve our muscle capabilities in an endurance capacity. So that's why we're doing high reps but low intensity. Any of these exercises are designed not only for the gym, but also can be done at home. So that's the beauty of it. You don't necessarily have to get out to go to the gym. If you can't get there, you can just do them at home.
Yep.
These exercises. Excellent. All right, finish up there. Next we're going to do is the glute raises. So with this, you want to sit down. You've got our 2 legs. And what we want to do is put our hands there by our side. And what we want to do is just raise our buttocks, our glutes up, and we want to drive through our heels, both our heels, and we just sort of raise it up till we get that make a bridge. Something like that. Now if that becomes too easy, what you can do is you can put one leg out straight, single leg, and do the same thing. Just drive through that other hill, just raise up. And during this you want to brace your abdomen when you're doing it. Have relaxed shoulders. Nice and up. Get you to do the 2 feet first. That's excellent. You want to be nice and straight on your back. And just drive up through your heels, bracing your abdomen, keeping your hips nice and straight. How does that feel?
Yeah, it feels good.
No pain in your lower back?
No pain.
Alright, let's try single leg. So just grab one leg, it doesn't matter which one, yep, and have it out. And then we do exactly the same thing, but before we do it, we just want to have a controlled way and think about the movement and then push through that hill and do the same raise, that glute raise. Oh, I'll just stay there, put that down, put back down. Alright, just bring your leg back up. We're just going to, with the single legs, it's probably not to tackle that at this stage. What we'll do is we'll just concentrate on the two legs first.
Yep.
And we'll build those muscles up and that endurance, and then after reassess it in a couple of months.
Okay.
And then we'll probably have a target to work towards doing that single leg raise. But initially, yeah, we'll just do the 2 legs for now. So just give me 2 more. And just give me 1 more. Nice, excellent. Okay, the last one we're going to do now is the plank. So if you just roll over, I'll just give you a demonstration. So you want to be on your forearms, and you just want to come up onto your knees. And you just want to hold that there in that position.
Okay.
You want to brace your abdomen. You want nice relaxed shoulders, keep that neutral spine, and we just want to hold as long as possible on there. Alright, get you to come down. On your knees, you just want to brace that abdomen, keep your hips nice and straight. Excellent. Squeeze through that scapula. And you just want to hold there. So what we're working for is between 40 and 60 seconds to hold it in that position. How does that feel? Don't feel any pain in your lower back or on your knees?
Pain.
Excellent. Alright, finish up there. Good work. Okay, Harold, now that we've finished part of our program, we're moving into the cool down phase. So we've done the exercise phase, and now we're in the cool down part of the phase of the program. Remember, in the cool down, we're bringing our heart rate from our exercise heart rate down now to our resting heart rate. So we don't want to do that too quickly, but we want to slowly work that down. And we're probably looking for around the 10-minute mark of working in our cool down. So we've only got a few minutes left of our cool down. What I'd like to do is just get some feedback from you from the program today.
Yep.
So earlier we identified in our pre-exercise screening that you had a knee injury and that you had completed your rehab. I want to make sure that I've met your goals and that the exercises we did for you today were appropriate and nothing was painful. So do you feel that those goals were met today?
Yeah, I think it was good. It really got me sort of back into movement, and I'm looking forward to coming back.
Yep.
And building my strength up again.
That's exactly what we want to be moving towards. We identified today also with the glute raises that we couldn't do those single leg raises. So we were working towards that for sort of like the next assessment in 2 months' time.
Yep.
So we'll work with the double leg glute raise, and then that'll get stronger for obviously moving into doing a one-legged glute raise.
Okay.
So that's it's a target that you can be aiming for. So
Yeah,
does that sound good?
Yeah, that'd be really good. So I build up the strength in my knee.
So we want to try and achieve this target for the next assessment, which will probably be in about 2 months' time. Did you enjoy yourself today?
Yeah, I really did.
You did?
Yeah.
And how are you feeling now?
Tired.
Tired?
Yeah.
No pain or anything in your knees or?
No pain. I think it was a good session to start off with.
Do you think with also the feedback, is there anything to adjust or take out of the program?
I'd like to start using some weights.
Yep.
And build up my strength.
Well, definitely we can look at working towards weights. Obviously, coming back from rehab, we're just doing our body weights and getting that initial strength and progress in the recovery. And then we can look for the next assessment whether we can include some down on the gym floor, doing some weights.
That'd be good.
Excellent. Well, thanks, Harold. We're almost finished now. We've just got the last couple of minutes. Once we finish, we're going to get you grab some water, and then we're going to move over into the area and do some static stretches.
Excellent.
Sound good?
Sounds good.
Excellent.